A tooth extraction is when we have to remove the tooth. Dentists do not like removing teeth. Patients do not like having teeth removed. It is not a popular procedure. However, sometimes it has to be done. You can drive home after a tooth extraction because the anesthetic we use is local. It only acts in the region where the tooth was extracted. After a tooth extraction, it's very important not to rinse, not to smoke, not to touch in any way the socket. What happens is we encourage a clot to form. That clot is very important because that is what's going to start the healing process, and then the tissues will close over the bone. If that clot is washed away or disturbed, it is called dry socket. The bone is now exposed and it can become infected, and it is very painful. Do we replace extracted teeth? It depends on which tooth was extracted. If it's wisdom teeth, usually they don't need to be replaced. If it's a front tooth, obviously we will be looking at trying to get either an implant or a bridge, or if that's not possible, a denture also. It's important to replace teeth. Each tooth has a function. The minute a tooth is missing, the opposing tooth will either grow out of its socket trying to find a tooth to bite again. The other teeth will work harder than they should because they're covering up for the missing one. It's very important not to be missing teeth.